So now that we're all good and pissed off at United Healthcare, let's talk about universal healthcare. United Healthcare was trying to become a single payer system, which leads to universal healthcare. Right now, large insurance companies and large pharmaceutical companies own 60% of our private, used to be private, healthcare. Our doctors, our surgery centers, our pharmacies, they own 60% of it already. By the end of this year, 2024, we will be 64,000 doctors short in order to take care of the American people. Do you know why doctors had to sell out to these large corporations? It started with the Affordable Care Act, also known as Obamacare. Once that took place, the large corporations were able to eat up the smaller insurance companies. There was no competition anymore, and the larger corporations were able to set these extremely low reimbursement rates for their doctors and hospitals and procedures to be done. Rates that doctors cannot afford to run an office on, cannot afford to run hospitals on, cannot afford to run pharmacies on. But they have no negotiating. There is no way to negotiate with them because the companies are so large. The doctors have no leverage. Doctors aren't sitting on piles of money. They really aren't. So they've 60%, they've sold out. They sold out. They had no other choice. So if you are really irritated now that you are only getting a 10-minute appointment with your doctor, you're going to be extremely irritated when it's a 3-minute appointment with your doctor. And if you're really ticked off that it took you 3 months to get in to see that specialist, it's going to really tick you off when it takes you 8. You need to think about these things. Look at what has happened with United Healthcare, United Health Group, and envision it. Because that is what universal healthcare is going to look like. Free healthcare sounds great. Nothing's free.